Classification of carriers. So, carrier is an infected person or animal which harbors microorganism in the absence of desirable clinical symptoms, serve as a potent source of infection for others. So there are different types of carrier. It include incubatory. Based on type, there is incubatory, convalescent and healthy carrier. Based on duration, there is temporary and chronic carrier. Based on portal of exit, there is urinary, intestinal, respiratory and other carriers. So in type, first one, incubatory carrier. So incubatory carrier means the carrier that transmit infection during the period of incubation. For example, measles, mumps, polio, hepatitis B, etc. will be transferred from one person to another during the period of incubation. So that is known as incubatory carrier. Next one, convalescent carrier. So convalescent carrier means convalescent carrier, they will continuously shed microorganism during their convalescent period. For example, cholera, typhoid, etc. Next one, healthy carrier. Healthy carrier means the person will not show the signs and symptoms of any disease. The person is look healthy, but he carries microorganisms and he transfers to others. So that is known as healthy carrier. The person will not show the signs and symptoms of disease, but he transmit infection to others. Next one, duration. Based on duration, there is temporary and chronic carrier. So temporary carrier means here the person transmit microorganism for a temporary period of time. If the patient have some disease, during that temporary period, the person will be transmit microorganism to others. Next one, chronic carrier. Chronic carrier means the person, those who are infected like with malaria, dengue, etc. They will transmit microorganism to others for a chronic period. So that is known as the chronic carrier during a, especially in case of malaria. Okay, so the person, they will transmit microorganism to others. Next one, based on portal of exit. So here the urinary carrier, the urinary tract infections, then intestinal, that is portal of exit, usually the diarrhea, cholera, through fecal matter it may transfer. Next one, respiratory, especially the TB can be transmitted by respiratory route during cough or the respiratory nuclei. Okay, then others, it includes the common cold, diphtheria, etc. can be transferred from portal of exit. So this is the classification of carrier.